Hi and welcome to ECCB Connects, a production of the Eastern Caribbean Central Bank to share with you who we are, what we do, and how we serve you. Climate change, health, and nutrition. In this program, Associate Dean at Florida International University, Dr. Cheryl Holder, explains how these are all connected. Stay with us. We'll be right back after this message.
When the ECCB took the bold step to introduce Dcash, the people of the Eastern Caribbean Currency Union were at the heart of this decision.
It's about creating opportunities.
It's about connecting family.
It's about linking friends.
It's about changing the way we do business.
It's about transforming lives.
A journey to a place where none have gone before will not be without its challenges.
But challenges will not deter us from our goal. It's about me.
It's about you.
It's about all of us.
So join us and let's make history together.
Thanks for staying connected. The focus of the 6th Growth and Resilience Dialogue was climate change challenges for the region's energy, tourism, and health sectors. The ECCB, in collaboration with its partners, the OECS Commission, the World Bank, and the University of the West Indies, hosted the dialogue in April. Associate Dean at Florida International University, Dr. Cheryl Holder, was among presenters at the two-day virtual event. In her presentation on climate change, the environment, and the impact on the food we eat, Dr. Holder connects the dots on how climate-related issues affect health. Among the solutions she offers for safeguarding our health is better agricultural practices for the best outcomes.
I always start my presentations with Miss Anime, and I use her because she's an example of what I see much in the US of the vulnerable population, which is usually an older woman with multiple medical conditions, multiple medications, and with her own climate story, which shows the impact of the cost of providing health for poor people and the impact it has on their overall health. She made me realize when she couldn't pay her light bill and I had to find a way to help her, how hot the days and nights were. And you have heard that that's one of the biggest impacts in the hot nights, which is impacting our body and sleep and making us not being able to adjust to this rising temperature. And it comes down to a lot of CO2 in our atmosphere. And that CO2 and the greenhouse gases in the US is coming from major transportation and industry like agriculture and other industry and electrification. And over worldwide, agriculture is about 24% of the greenhouse gases. So it shows the huge impact that the pollution in that thin line that I have that you look at of what surrounds our planet, that atmosphere is getting too polluted and it's not allowing the heat to be reflected back out and is creating that warm blanket around our planet and heating our planet. You've heard of the impacts, the direct impacts, the spread of disease, the water and food supply, and the disruption of emotional well-being, which is driving the health impacts. But we know by so many data that's coming out more and more, you've heard of the environmental factors, and more so, I want you to look at the pictures of the vulnerable people, the pregnant women, the children with the high CO2 levels, and our vector-borne diseases, which is creating that temperate region, what you've heard of going further up, and of course, the mental health issues. And when we get to the food supply, which is what we have to think about, is that our agriculture and our fisheries live in a specific temperature. Our humans not just agriculture and fish and insects, but humans also do best at a certain temperature. And as that temperature rises, we see that change in the habitat, where the ranges are changing, the crop planting days are shifting, people are moving, the droughts, the floods, which is hindering what kind of foods we have. And with the increasing CO2, you're also seeing plants that are growing faster, trees are growing faster, the plants are growing faster, but they're unable to incorporate the nutrients from the soil at the rapidity of their growth, which is decreasing the nutritional content in most of the foods that are grown. And this was from 2015, where they looked at the worldwide impact of agriculture. And what we're seeing is a decrease in production worldwide. Now, much of the Caribbean is dependent on the rest of the world, like in terms of when you think of what's going on in Ukraine, how that's affected the world wheat supply. So if the whole world is having diminishing production, we are going to see even more impact in places of the Caribbean that's dependent on importation. And when you think again, and I use the immune response, how important nutrition is. And because of coronavirus, I'm so in tune to what's going on with our immune system and how we can strengthen our immune system, where everything from how we respond with the oxidative burst are making more of our cells, how we can help to keep our cells alive during such a period. And that is totally dependent on the nutrients that we take in, from the vitamin D, the A's, the zinc, the iron. And you hear so many people are talking about what supplements they're taking during this coronavirus. But at a baseline level, we have to have a healthy immune system, a healthy body, and nutrition is key. And when you look at all the foods that we need, the fruits, the vegetables, just to get our vitamin A, and you look at what comes with our B12, the fish, and we talk about the pollution that's killing our, especially I saw a comment about the sargassum, which is taking over our seas and decreasing our fish life. The heat is killing our fish. The foods that are vitamin C, the citrus crop, the fruits and vegetables. If we have drought and we have all the changes that we're seeing, how are we going to have the nutrition that's going to improve our lives? And again, the vegetables, the peanuts, all the different things that are incredibly important for our immune system. And it's ongoing. And I use this opportunity to show you and help you to understand how crucial having natural access to proper foods is important in our health. And I use this to illustrate the main health issues that you've heard, but not so much about the health. What I want you to look at is that iceberg behind, because our research is just at the tip of where we need to be. We don't have all the full impacts of what this climate is changing, what the insects, what the vectors, what the bacteria, how the things are changing as it grows, and what that impact will have on our health. But what we know is that every climate solution is a health solution. And so we look at the opportunities to improve our health as we move forward. But we cannot improve our health without having a full understanding that what drives our health outcomes is where we live, where we work, where we play. It's our social determinants. It's our socioeconomic factors. It's our health behaviors. It's not the genes. And with us, the physical environment with the heat is putting a huge blanket on this social determinants. But unless we address the social determinants, but you heard of the monetary system, the political system, the healthcare systems, we are not going to make a move in this whole improving our nutrition, improving our health. Policy matters. No matter how much change I take individually or you take individually, we are not going to get the control and the reduction unless we drive our politicians locally and worldwide to implement the policies that will decrease the fossil production and look at how we're going to protect the vulnerable populations to get the most immediate response. So when I look at this picture of Florida, if we do nothing in the next 20 years, we are going to lose half of our peninsula. The Caribbean is not very far behind in looking at how sea level rise will impact the Caribbean. So what are we looking at? How would our solutions happen? And I bring this back, I use this from coronavirus. I haven't yet developed one for climate change. I need a graphic designer somewhere. But when you look at it, To fight coronavirus, it is a shared responsibility and a personal responsibility. And it's a Swiss cheese effect. There are multiple things that we have to do as our society, as our individuals, as working together. And you've heard of different effects with the monetary system, the things that the WHO and the UN are doing. But unless we look at every aspect that must come together to protect us and to help us adapt and mitigate the climate, we're not going to get very far. And the most vulnerable, the women, the children, the elderly, the poor people, especially the people who did not cause much of this loss in our climate, will pay the price. I just look at this, when you look at community engagement, infrastructure, environment, there are many things that we have to do to put that Swiss cheese together. But health professionals, I call out to them because they have an incredible role to play, because in the US and most of the world, health professionals are incredibly trusted. And our nurses, our doctors, our pharmacists, and I know Dr. Weeks is a pharmacist, we are calling out to that population to come together to do the education around this and to motivate folks. In the US, we're talking about 22 million. In the Caribbean, you're looking at enough folks per 1,000. If each of these health professionals took on the 1,000 people and drove that education, drove that protection, got the policymakers by motivating those 1,000 people to act, we will be a lot further. The agricultural practices, they're great. There are many things we could do. There's a lot of different ways of now rotating crops, even putting solar panels and growing crops beneath the solar panels. We have to look at decreasing our use of beef and ruminants so we can decrease the greenhouse gases, decrease how we use our fertilizers, and decrease our soil disturbances. And when we look at opportunities, I have educating women and girls. The data clearly shows that when you invest in women and girls, just educating them, you don't have to educate them on climate change, but having them be able to read and write, be financially stable and literate, they make the best health decisions. They also make the best economic decisions for a community. So that's really important. And same thing with the farms. We're looking at all projects. How do we include equity and who we're going to build up? Because the large farms do not feed the world, and most of the Caribbean is fed by the smaller farms. How do we bring the technology? How do we bring innovation to that group? Moving to a plant-based diet, at least dropping meats once a week, increasing food waste. There's so much we can do, but you have to educate, you have to engage, and you have to activate people to work. We talked about that again. We must act now, prepare, advocate for policy changes, look at how we're going to decarbonize our health sector, our businesses, and our homes. I think the IPC made a really good point in this report. It was kind of damning in one sense, but many opportunities, because our most urgent response has got to prioritize equity, gender, and income inequalities, while we do it simultaneously as we address the climate. Because climate solutions are health solutions. And this is an opportunity to improve our nutrition, improve access, ready access, local access to proper foods that are not overprocessed, not all imported, and will hopefully drive a better health outcome in an urgent manner.
And now for this week's financial tip.
Have a financial goal. If you don't know where you're going financially, you may end up somewhere you don't want to be.
That's how we end this episode of ECCB Connects. Thank you for watching, and be sure to connect with us next week when we'll be back with another program.